Hi, I'm Dr. Zach Goodman with Goodman Human Performance. Today we're going to go over the adductor release. I found this one to be actually quite difficult unless done this way. So what we're going to do is I'm going to use a medicine ball, which is a weighted ball. It doesn't need to be that. You can use an inflated basketball, an inflated soccer ball. Any of those, that size of a ball will allow you to release this area. The adductors is a group of muscles that goes down the inside of the leg. They're typically very tight, and when these are tight, what they can do is pull your pelvis into an anterior tilt. That is a forward tilt, dumping of the pelvis forward. So once we release these, you'll feel some relief on the inside of the leg, and also it can help get the pelvis back under your body. When you're doing this, be very careful. There are arteries and veins that go inside, that run along the inside of your leg. So if you're on them, you may get some weird sensations, things like numbness in the area or down the leg. You can get tingling. You can also get things like warmness or this feeling of coldness in the area. If you're on those, or if you have any prior issues to this, either don't do this release, or check with your doctor or a specialist to see if you can indeed do this release. So, like I said, I'm going to be using a medicine ball for this release. The adductors go down to the knee. You're going to release either just above the knee, and it can be anywhere up into the inside of the hip and pelvis. It can get very tight in there. This release looks a little funny, but it is a great one. So what I'm going to do is I'm going to go face down, almost like a plank, over this ball, and I'm going to almost wrap my hip and pelvis around the ball. And I'm just finding for the tightest, most tender spot in here, okay? And what I'm going to do is just sit there for a moment and let my body relax over it. Breathe. It can get more intense as you relax more, or if it already is intense, can reduce. We're just looking for that feeling of reduction of pain in general. It can take a couple of minutes. If you're not getting anything high up into the hip, you can move your way down. Okay. Sometimes it's more towards the front of the inside of the leg. Sometimes more towards the back. But as I move down towards the knee, I'm getting a little bit of tenderness right in here. So I'm just going to hold that and breathe. As you can see, I have the froggy leg out here. I am holding a plank, which can get uncomfortable for the shoulders. If it is, you may want to take a break. And also, I'm kind of have this left leg kickstand as a kickstand out here. Again, if it is too much on the shoulders, you can come down a little bit, but it does put the body in a generally a more uncomfortable position. Okay. As I get up higher into the leg, you might move towards the back and feel it a little bit more. Again, as funny as this looks, this is a phenomenal release for these adductors. You're going to hold this release for about 3 to 5 minutes. It'll take about 1.5 minutes for that tenderness to start to fade. And then you want to release that knot or that ball that you might feel on the inside of the leg. Again, don't do this if you feel any numbness down into the leg, a warming feeling, or a cold feeling down into the leg or the lower leg into the foot. If you have any prior issues, again, please check with a specialist or a doctor before you attempt this. I'm Dr. Zach, and I hope you appreciate this. Thank you.